Dr. Evan here to talk to you about sleep. So yesterday I was having an interview with Mike Mutzel. Lots of fun, talked about a lot of great things about fatigue. And one of the things that came out of that was talking about sleep. So I want to share with you my tips today about how to get to sleep better, faster, deeper sleep, and all that good stuff. So people are usually surprised when I tell them that I actually get more people to sleep well at night by giving them things in the morning. So iron, B12, adrenals, thyroid, all of these things that are wonderfully nourishing and stimulating, you give them in the morning and it helps people sleep at night. So why is that? Well, a lot of times sleep is a circadian rhythm issue. And so that means that your body's sleep-wake cycle is all disturbed, meaning the body doesn't know if it's supposed to be awake during the day or asleep, and vice versa at night. So you kind of get this picture instead of like awake during the day and then it comes down throughout the day and then you're sleeping at night, you get this picture where you're kind of going up and down and up and down. So we want to recreate a normal circadian rhythm, a normal pattern. And so we do that by boosting those things that I mentioned in the morning. And so if you've gotten your labs with your doctor, with your provider, this is what you're going to want to look at. You're going to want your B12 level to be above 1500. You're going to want your cortisol level, which is your main adrenal hormone, to be between 15 and 25. You're going to want your DHEA, which is your adrenal reserve number, to be above 300 for men and above 150 for women. With thyroid, you're going to want your free T4 level to be between 1.2 and 2.0. And your free T3 level to be above 3.0, between 3.0 and 4.0 generally. So if your numbers are lower than that, it could mean that one of those components is causing your sleep difficulties. So that's recreating your circadian rhythm, and that helps people sleep, fall asleep, stay asleep, all that good stuff. Now, if you're perimenopausal or postmenopausal, that's when we want to talk about estrogen and progesterone. So progesterone helps women fall asleep, and estrogen helps them stay asleep. So if you're having a hard time falling asleep and you're postmenopausal or perimenopausal, which means right around the time of moving into menopause, then you're going to want to take progesterone at night, or something that increases progesterone. And then the same thing with estrogen. If you're waking up during the night, oftentimes, once again, it can be a circadian rhythm issue, but oftentimes it's because you're not getting enough estrogen. And then lastly, some of the things that you can use as a band-aid while you're moving towards fixing all of these things to create a better set point for yourself, create optimal health, is using melatonin, serotonin, precursors are 5-HTP, which will then increase melatonin to help you sleep. And then I really like a product that we carry called Insomnitol, which is a combination of a number of things, some really calming herbs that are really helpful. And then if I do need to use a pharmaceutical, I'll use Trazodone, which is a weak antidepressant, and it turns out it's a good sleep aid. And so I will use that if I need to as a band-aid while we're helping to get people better. So those are my tips today on sleep. Have an amazing day. Take care.